Hi there, it's Dr. David Greene, founder and CEO of R3 Stem Cell, the global leader in regenerative therapies. Today, I'm discussing stem cell treatment for multiple sclerosis in South Africa. We recently opened a beautiful clinic in Johannesburg, in the Melrose suburb, that offers first-rate stem cell treatments for the whole continent, not just South Africa. So let's talk about what happens with multiple sclerosis. So around the world, R3 Stem Cell has been treating MS with stem cell therapy in 8 countries. And we've done many cases for individuals. So first of all, what's happening in MS? Well, it is truly an autoimmune issue where the body is fighting against the covering around neurons. Now, the neurons that we have in our body are covered by something called myelin. And myelin helps to act as a conductor for neuron activity to connect impulses, but from one neuron to the next, to the next, to the next. And when the conduction is there with the myelin, it can transmit those impulses very fast. Without myelin, either the nerve impulses are slowed down tremendously, or at a certain point, they just don't connect anymore. So as the MS disease progresses and the myelin is continuously destroyed, it can get to a point where people can no longer walk. It becomes hard to perform activities of daily living. And one of the biggest problems right now is the existing approved treatments, so for instance from the FDA in the United States, are helpful, but they have not been shown to restore the myelin sheath. So at a certain point, they're not really helpful as far as things that this could do if the myelin sheath was restored. The second big problem is that there are so many side effects associated with standard MS treatment that we hear from patients all the time. What might those be? Well, think about it. If you're going to give large anti-inflammatory treatment with steroids, cortisone medication, there are tons of issues that can result. Adrenal gland complications, Cushing's syndrome, water retention, you name it. Now, some of the FDA-approved style of treatments are really almost like a chemotherapy type of treatment. So talk about complications from that. It can be very extensive. And some things that it can do is it can spark up other autoimmune diseases that have been sort of laying potentially latent. So we have a patient recently who's done extremely well with stem cell therapy, but initially she tried the chemotherapy-style medications and steroids, which caused her optic neuritis, psoriatic arthritis. It caused her colon to stop working. She had to end up getting a colectomy. So it was a disaster. When she had the stem cell therapy, it's now been 16 months, she was able to put all of that at bay, and now she's back at work as a nurse practitioner. So we have a lot of success stories of that. So let's talk about what is happening with stem cell and exosome therapy for MS. We use umbilical cord stem cells. We've been doing that for the last decade. They've been shown to be very powerful, pure, and potent. And one of the things that they've been shown to help with is not only preserving the myelin sheath and stopping the MS from destroying it, but also helping to restore some of the myelin sheath. And also, this is interesting, if myelin has been completely removed from a neuron, that neuron can still work. Granted, it doesn't have the conductive, sheath. It's not going to transmit as fast, but it can still function. And stem cells and exosomes can protect the naked neuron from irreversible damage. So there's multiple ways that it can truly help patients who have MS. Now, when we give these treatments, it's been very safe overall. The way that we do it is through an IV drip, and we do it through an injection into the back, and that's called intrathecal. Intra and then T-H-E-C-A-L, and that's basically a reverse spinal tap through the lower spine. All right, we can do it under sedation if a patient needs that. Most adults don't. They tolerate it really well with superficial numbing, and our anesthesiologists, they've been doing these treatments, every week for many years, so there's a lot of experience, okay? Now, the IV is, super straightforward. The side effects that we've seen have been mild to moderate and include things such as low-grade fever, some nausea, maybe a little vomiting, chills, lightheadedness, dizziness. We've done over 27,000 of these procedures in the last decade. We have not seen, knock on wood, although I think this is concrete. No, that's wood. We haven't seen a deep infection, a disease transmission, a rejection of the cells. Our biologics only come from labs that perform quality control testing that is equivalent to the USA FDA, testing for bacteria, virus, fungus, along with a litany of disease testing to make sure that the stem cells are very safe to be used. You don't have to be matched to the donor stem cells because the stem cells used and the exosomes, they don't have MHC2 markers. All right, those are the ones that would cause a rejection, and they don't have a presence on the umbilical cord stem cells and exosomes. So you don't have to worry about that. Now, I know what patients really want when they come in for treatment for MS. They want a one-time, one-and-done cure. But unfortunately, in this current state of regenerative medicine, that doesn't exist. But stem cell therapy for MS has been far and away superior to the traditional medications. A lot of patients just cannot tolerate them. Well over half have so many side effects that becomes like a risk benefit, as opposed to stem cell treatment where the benefit significantly outweighs the risks. One of the beautiful things is that instead of the analogy that I like to use with a lot of the traditional medications is that you're putting basically dropping a grenade on a cockroach, so to speak. All right. Now with stem cell treatment, you're dropping like you're using like a surgical scalpel, so to speak, for the problem. It's very precise in a sense that it actually helps boost the rest of the immune system while decreasing, severely the degeneration of the myelin sheath. So you get the benefit with a very low risk profile, and it's a treatment that can be repeated every year, 2 years, in between to get benefits that continue. So visit us online today at r3stemcell.com/South-Africa, all right, or if you just type in R3 Stem Cell South Africa, the website will be the first result, all right? The center is beautiful. We try to make it simple for patients. We do free consultations, and then we'll send over, a quotation. We also have a very good consumer guide on stem cell therapy for multiple sclerosis. We'll send you that, or it's a free download on our website, all right? And then we offer free ground transportation and hotels that are on site. There's a couple Marriott hotels. That's where I stay. They're fantastic. And then call us at the number listed in the description, and we'd love to help you. Thank you.